Good day, everyone. We are the Black 2 Group 1, and our topic is all about sudden infant death syndrome. Introduction. An infant 10 weeks old, apparently in perfect health, suddenly died while sleeping, and after having been asleep 1.5 hours, there had been no struggle, and the face was not livid. On post-mortem examination, Dr. C found no morbid appearances, except some serious infusion in the ventricles at the base of the brain. The latter organ was also somewhat congested. The thoracic organ were all healthy and the larynx free of obstruction. An infant cousin of the child had died in a precisely similar manner. Dr. C was unable to account for the death, unless the infusion might possibly have been accumulating insidiously for some time until it becomes sufficient to destroy life. What is sudden infant death syndrome? Sudden infant death syndrome, or SIDS, has caused much grief and anxiety among families for centuries. It is also defined as death in infants younger than 12 months of age that occurs suddenly, unexpectedly, and without obvious cause. SIDS cannot be explained despite a thorough investigation, including a complete autopsy, examination of the death scene, and review of clinical and social history. SIDS is also commonly called as crib death. So the rationale of this is that the risk of SIDS can be greatly reduced.
Patient's profile. Demographic data. Name, Monica Rose Kuche. Sex, female. Age, 4 months. Weight, 14.2 pounds. Height, 24.4 inches. Nationality, Filipino. Religion, Roman Catholic. Birth date, March 16, 2023. Birthplace, Ramiro Hospital, Tagbilaran, Bohol. Address, Lomboy, Pangangan, Calape, Bohol. Number of siblings, 1. Medical diagnosis, sudden infant death syndrome. Chief presenting complaints, sudden infant death. History of present illnesses, none. Family history, first degree and second degree cousin of the infant died precisely in a similar manner. Past medical history. The patient was born term via spontaneous vaginal delivery with a birth weight of 3.4 kg. There was no complications and she was discharged home from the hospital with her mother on day of life 2. Since then, she has been well. Exam. Vital signs are as follows. Temperature 35.3 degrees Celsius. Pulse 140 BPM. RR 24 BPM. The infant appears well with a normal physical examination. Clinical course. The patient remains well appearing in the ED without any abnormalities in her vital signs. She is admitted to the hospital for further observation and monitoring.
The anatomy and physiology. The nervous system is the master controlling and communicating system of the body. Every thought, action, and emotion reflects its activity. Its signaling device or means of communicating with body cells is through electrical impulses, which are rapid, specific, and cause almost immediate responses. The nervous system is divided into 2 parts: the CNS or the central nervous system and the PNS or the peripheral nervous system. The CNS consists of the brain and the spinal cord, while the PNS is a part of the nervous system outside the CNS, which consists of the nerves that extends from the spinal cord. Today, we will focus only on the central nervous system. As we all know, the brain is found in the skull. It is commonly discussed in its 4 major regions: the cerebrum, cerebellum, the encephalon, and the brainstem. The first region is the cerebrum. Cerebrum is the most superior part of the brain and the largest among the other regions. It is divided into 2 major hemispheres, the left and the right hemisphere, and further divided into 4 lobes. These 4 lobes are the frontal, parietal, temporal, and occipital. The frontal is the one responsible for reasoning and thought. Parietal is the one responsible for integrating sensory information. The temporal is responsible for processing auditory information from the ears. And occipital is responsible for processing visual information from the eyes. Next is cerebellum. Cerebellum is a large cauliflower-like and is located below the cerebrum. It is responsible for muscle coordination, posture, balance, and muscle tone. The encephalon or the inner brain sits atop the brainstem. It contains two structures, the thalamus and the hypothalamus. The thalamus is the relay station for sensory impulses passing upward to the sensory cortex, while the hypothalamus is the one who plays a role in the regulation of the body temperature, water balance, and metabolism. It is also the center for many tribes and emotions such as anger, fear, pleasure, pain, and affection. The brainstem is the stalk-like part of the brain that connects brain to the spinal cord. It is made of three parts: the midbrain, pons, and the medulla oblongata. The midbrain is the one responsible for certain eye and auditory reflexes. The pons, it is responsible for certain reflex actions such as chewing, tasting, and saliva production. And the last is the medulla oblongata. It is located in the lowest part of the brainstem and it connects to the spinal cord. It is responsible for regulating heart and blood vessel function, digestion, respiration, swallowing, coughing, sneezing, and blood pressure. It is also known as the center for respiration. Now that we covered the part of the brain, let's move to the other part of the central nervous system, which is the spinal cord. Spinal cord is the link between the brain and the nerves of the body. The three primary roles of the spinal cord are to send motor commands from the brain to the body, send sensory information from the body to the brain, and coordinate reflexes.
Pathophysiology of SIDS or Sudden Infant Death Syndrome. Sudden infant death syndrome continues to be most common cause of postneonatal infant death. SIDS is a complex, multifactorial disorder, the cause of which is still not fully understood. However, much is known now about environmental risk factors, some of which are modifiable. These include maternal and antenatal risk factors such as smoking during pregnancy, as well as infant-related risk factors such as non-supine sleeping position and soft bedding. Emerging evidence also substantiates an expanding number of genetic risk factors. Interactions between environmental and genetic risk factors may be critical importance in determining an infant's actual risks of SIDS or sudden infant death syndrome. Although no practical way exists to identify which infants will die of SIDS, nor is there a safe and proven prevention strategy. Even if identification were feasible, reducing exposure to modifiable risk factors has helped to lower the incidence of SIDS. Current challenges include wider dissemination of guidelines to all people who care for infants, dissemination of guidelines in culturally appropriate ways, and surveillance of SIDS trends and other outcomes associated with implementation of these guidelines.
Hi, I am Ruby Crane Capin, and here are the Gordon's 11 functional health patterns. Number 1. Health perception, health management pattern. The patient's parent described infant's health status as fair. The patient was born term via spontaneous vaginal delivery. There were no complications and she was discharged home from the hospital with her baby. The infant is not yet fully immunized. He has not yet received a vaccine for measles. The mother sees to it that the baby has his regular monthly checkup. Also, the mother told that her son doesn't have any accident or injury. The baby apparently perfectly healthy, but after the postmortem examination, the doctor found some serious infusion in the ventricles at the base of the brain of the baby, and the latter organ was also somewhat congested. Number 2. Nutritional metabolic pattern. The client weighs 3.4 kg. His mouth is pink and moist and doesn't have any lesion. His skin is warm and intact and doesn't have any rashes. He is breastfeed baby. His mother breastfeeds him for 6 to 8 times during day and 2 to 3 times at night. The infant drinks 1 to 3 millimeters of water for 3 to 4 times a day. His mother does not yet give him any other food except for breast milk. Number 3. Elimination pattern. The infant uses 3 to 6 diapers per day. He defecates daily, usually twice a day. His stools is soft and golden yellow and not foul smell. Number 4. Activity exercise pattern. The infant is not cyanotic. He can do hand grasp in both hands. Also, he knows how to roll over. He was able to show some reflexes. He has strong grasp on both hands as well as his push-pull ability. He is still dependent on his mother and other caregivers for feeding, his hygiene and dressing or grooming. Number 5. Sleep rest pattern. The infant usually sleeps at 7 p.m. and wakes up at 4 to 4:30 in the morning. The infant has a 9 to 9.5 hours of sleep. He takes 1 to 1/2 hours of sleep during late mornings and take 1 to 2 hours of nap in afternoon. Number 6. Cognitive perceptual pattern. The infant is a happy baby. Vision and hearing is developing. Number 7. Self-perception, self-concept pattern. The client has no body language and cannot establish an eye-to-eye contact. He communicates through crying and cooing sounds. Number 8. Rule relationship pattern. According to the mother, the infant is considered as the apple of the eye of the family. He is still dependent on his parents and other caregiver for his needs. Number 9. Sexuality reproductive pattern. The infant is male. His reproductive organs is healthy and complete and doesn't take any medication. Number 10. Coping stress tolerance pattern. In relation to his age, the baby expresses his stress through crying. Whenever he cries, his parent, specifically his mother, cuddles him or sometimes breastfeed him. Number 11. Value, belief pattern. The infant is Roman Catholic. Due to his very young age, he is not yet affected by any religious practices. He is not yet aware of divine power.
Sudden infant death syndrome nursing care plan. Assessment. Subjective. Grabe kaayo kasakit nga namatay akong baby as verbalized by the patient mother. Objective. Frequent crying. Appears well with normal physical examination. Vital signs taken. Temperature 37 degrees Celsius or 98.6 degrees Fahrenheit. Pulse rate 140 BPM. Respiratory rate 24 BPM. Nursing diagnosis. Risk for fatal injuries or death related to improper sleeping position and unfavorable sleeping environment as evidenced by the frequent crying. Planning. After 8 hours of nursing intervention, the infant risk for sudden infant death syndrome or SIDS will be reduced. Nursing intervention. First is to identify the risk factors that may increase the likelihood of SIDS. Its rationale is that thorough assessment of risk factors, the maternal, physical, and the environmental, will help reduce the risk of SIDS. Second intervention is to advise the parents to always place the baby on his or her back when sleeping during the first year of life. The rationale is that research shows that babies who sleep on their stomach or side might experience difficulty of breathing more than those who sleep on their back. The baby can assume other position when he or she is awake or already able to roll both ways without the parents' help. Third intervention is to let the baby sleep in the same room as the parents. The rationale: it is highly recommended that the infant's crib or bassinet is placed in the bedroom of the parents so that they can check on the baby more often. Fourth nursing intervention is to educate the parents on how to establish a favorable sleeping environment for the infant. The rationale: an infant sleeping in prone position on a soft mattress, waterbed, fluffy comforter, or even with pillows may experience blockage of airway or suffocation. Another intervention is to promote breastfeeding as much as possible. Research shows that breastfeeding lowers the risk of SIDS, especially in the first 6 months of life. If the baby is 3 weeks old or more, the mother may offer a pacifier that has no strap or string while sleeping. Another intervention is to encourage infant immunization. Some common infant respiratory diseases such as pertussis or whooping cough can be prevented through vaccination, which can then lower the risk of SIDS. Evaluation. After 8 hours of nursing intervention, the infant's risk for sudden infant death syndrome or SIDS was being reduced, therefore, the goal was met.
Severe infant death syndrome prevention. There's no guaranteed way to prevent SIDS, but you can help your baby sleep more safely by following these tips. Back to sleep. Place your baby to sleep on his or her back rather than on the stomach or side. Every time you or anyone else put the baby to sleep for the first year of life, this isn't necessary when your baby's awake or able to roll over both ways without help. Keep the crib as bare as possible. Use a firm mattress and avoid placing your baby on thick fluffy padding such as lambskin or thick quilt. Don't leave pillows, fluffy toy or stuffed animals in the crib. This can interfere with breathing if your baby's face presses against them. Don't overheat your baby. To keep your baby warm, try a sleep sack or other sleep clothing that doesn't require additional covers. Have your baby sleep in your room. Adult beds aren't safe for infants. A baby can become trapped and suffocate between the headboard slats, the space between the mattress and the bed frame, or the space between the mattress and the wall. Breastfeed your baby. If possible, breastfeeding or at least 6 months lower the risk of SIDS. Lastly, immunize your baby. There's no evidence that routine immunization increases SIDS risk. Some evidence indicates immunization can help prevent SIDS. So, the vitamin K, erythromycin, and the hepatitis B.
Overall evaluation. Coping after SIDS. Losing a baby to SIDS can bring emotional distress to the parents and other family members. Feelings of guilt, anger, or regret may cause dysfunctional coping. Therefore, it is important for the healthcare team to provide emotional support by means of the following measure: referral of the parents to a local support group on SIDS, referral of the parents to counseling or physiological help if needed, help in establishing communication between the parents, their family members, trusted friends, or clergy member. Another is to reassuring the parents that it is okay to grieve and allow time for healing.